In all of this, I will be very frank about the challenges we face and the difficult balances we must try to strike. None of this is easy. I am acutely aware that in every decision we take, lives and jobs are at stake, and I want to assure not just the Chamber but the country that none of these decisions are taken lightly. First, though, let me give a summary of the daily statistics that were published a short time ago. Since yesterday, an additional 1,054 cases have been confirmed. That represents 13% of people newly tested and takes the total number of cases to 34,760. A total of 319 patients are currently in hospital with confirmed COVID. That is an increase of 57 since yesterday. And 28 people are in intensive care, which is an increase of 3 since yesterday. I regret to also report that one further death has been registered of a patient who had been confirmed as having the virus, and the total number of deaths in Scotland under that measurement is now 2,533. National Records of Scotland, though, has also published its weekly update today that includes cases where COVID is a suspected or contributory cause of death. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID was 4,276. 20 of those deaths were registered last week. That is the highest weekly number of deaths since late June. Every single one of these deaths represents the loss of an irreplaceable individual, and again I want to send my condolences to all those who are currently grieving. These figures illustrate the rising challenge we again face from this virus. That challenge is also set out starkly in an evidence paper published today by the Scottish Government's senior clinical advisers, the Chief Medical Officer, the Chief Nursing Officer and the National Clinical Director. It assesses our current situation in relation to COVID, and it explains, as I will try to do in this statement, why we must introduce additional measures to control the virus, why it is urgent that we act now, and why we have decided upon the specific actions that I am setting out today. Before I come on to that, though, let me emphasise some of the more positive elements of our current position, because it is important, I think, for the morale of all of us, that we don't forget that progress has been made. It might not feel this way, but the situation now is better than it was in March. We are benefiting from the sacrifices made over the summer by driving the virus to very low levels. Then we have helped to ensure that even after several weeks of increases, the estimated total number of cases is currently just 13% of the peak level back in March. Cases are rising, but not as quickly as they were then. In addition, and most importantly of all, we now have Test and Protect teams across the country who are doing exceptional work. Test and Protect is now bearing a lot of the strain of controlling the virus. And of course, we understand more now about how to reduce the risk of transmission by meeting outdoors rather than indoors if possible, wearing face coverings, cleaning our hands thoroughly and keeping our distance from people in other households. So while there are significant restrictions still in place, and they are hard and painful, we are living much more freely now than in the spring and early summer. And we are determined, if at all possible, that this will continue. So I want to be clear, we are not going back into lockdown today. We are not closing schools, colleges or universities. We are not halting the remobilisation of the NHS for non-COVID care, and we are not asking people to stay at home. So while the measures I announced today will feel like a backward step, and in many respects I know they are in the interests of protecting our progress overall. It is by taking tough but necessary action now that we hope to avoid even tougher action in future. Let me turn now in more detail to the state of the virus. The need for action is highlighted by the daily figures I reported a moment ago, but more fundamentally in the evidence paper published today. It's worth remembering that when I updated Parliament just over 2 weeks ago, the average number of new cases being reported each day was 285. That was up from 102 3 weeks previously. Now we are reporting an average of 788 new cases each day. In addition, I can report that in the 7 days up to Monday, the number of people in hospital with COVID increased by almost 80%. And the number of people who died with COVID last week was the highest for 14 weeks. In fact, there was the same number of deaths in the last week alone as in the whole of the previous month. The increase in the numbers of people in hospital with and sadly dying from COVID reflect the rise we are now seeing in new cases amongst older age groups. In the second half of September, cases were rising most rapidly in the younger age groups, but in the past week, cases in people over 80 years old increased by 60%, and cases in the 60 to 79-year-old age group more than doubled. And we're seeing geographic as well as demographic spread. Without a doubt, and by some distance, the highest levels of infection are across the Central Belt. We are particularly concerned about Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley, and that will be reflected in what I say later. But that should not obscure the fact that numbers are rising across the country. The majority of our health board areas are now recording more than 50 new cases per 100,000 of their population each week. And virtually every health board area has a rising number of cases. The only exceptions are Orkney and Shetland, and even they have had cases in recent weeks. There is also, as we speak, a significant outbreak in the Western Isles. So the need to act, and to act across the country, is clear. What is also clear is the need to take additional action now. I mentioned earlier that prevalence of the virus is currently around 13% of its March peak. However, we estimate that the number of new COVID cases is currently growing by around 7% each day. So without action, and this is perhaps the starkest warning in today's evidence paper, we are likely to return to the peak level of infections we had in the spring by the end of this month. It's also instructive to consider the experience of other countries. Our modelling suggests that we are approximately 4 weeks behind France and 6 weeks behind Spain in the resurgence of the virus. Their resurgence, like ours, was initially concentrated amongst younger people, but it spread to other age groups, and they are now seeing significantly more hospital admissions, more people in intensive care and more deaths. It is to interrupt that trajectory that we must act now. Of course, we have already taken perhaps the most important and certainly the most painful step we can to reduce transmission. For the last 12 days, apart from certain limited exceptions, we have not been able to meet up in each other's homes. That should already be making a difference to infection rates, even if, because there's always a time lag between introducing new measures and the impact they have, we're not yet seeing it reflected in our figures. And let me take the opportunity to emphasise again today how vitally important it is that we all stick to that rule. It's incredibly hard for all of us not to visit friends and family or have them visit us, but it is the single most effective measure we can take to stop COVID passing from one household to another. So please stick with it. That measure is vital, but the clinical advice I have received now is that it is not sufficient. We need to do more, and we need to do it now. And to those who will wonder and ask, understandably, if the measures I set out today go too far, let me be very clear about this. If this was a purely one-dimensional decision, if the immediate harm from COVID was all we had to consider, it is very likely that we would go further. But 7 months into this pandemic, I am acutely aware that this is not and cannot be a one-dimensional decision. We have a duty to balance all of the different harms caused by the pandemic. We must consider the direct harm to health from the virus, which must be reduced, but do that alongside the harm being done to jobs and the economy, which in turn, of course, has an impact on people's health and well-being. And we have to consider the wider harms to health and well-being that the virus and the restrictions deployed to control it are having on all of us. For all of these reasons, we are applying a far more targeted approach than we did in March, one which reduces opportunities for the virus to spread while keeping businesses and other activities as open as possible. And we are not recommending that people who shielded over the summer should return to staying completely indoors. We know how damaging that is to your well-being, but we do recommend that you take extra care, especially if you live in the Central Belt. You can now access information about infection levels in your local neighbourhood on the Public Health Scotland website. Let me now set out the additional measures that we are proposing. The measures on hospitality are intended to be in force for 16 days, from this Friday at 6 p.m. to Sunday the 25th of October, inclusive. In other words, across the next 2 weeks and 3 weekends. So firstly, with the exception of the 5 health board areas I will talk about shortly, pubs, bars, restaurants and cafes will be able to operate indoors on the following very restricted basis only. During the day from 6 a.m. to 6 p.m. for the service of food and non-alcoholic drinks only. Hotel restaurants will be able to operate beyond 6 p.m. but only for residents and without alcohol. The reason we are not closing indoor hospitality completely is that we know the benefits in terms of reducing loneliness and isolation, of giving people, particularly those who live alone, somewhere they can meet a friend for a coffee and a chat. But the restrictions will be strictly applied, and all the current regulations and the limits on meeting a maximum of 6 people from 2 households in indoor public places will still apply. Again, with the exception of the Central Belt areas I will mention shortly, bars, pubs, restaurants and cafes can continue to serve alcohol outdoors up to the existing curfew time of 10 p.m. and subject to the 6-2 rule on group size. There will be an exemption to these rules in all parts of Scotland, Presiding Officer. It's important to stress this, for celebrations associated with specific life events such as weddings that are already booked and funerals. The current rules for those will continue to apply. These are the new measures that will take effect nationwide. However, because of the significantly higher levels of infection in the Central Belt, we are introducing stricter restrictions in the following 5 health board areas: Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. In these areas, all licensed premises, with the exception of hotels for residents, will be required to close indoors and outdoors. Though takeaways will be permitted. Hotels, as I've said, will remain open for residents. Cafes which don't have an alcohol licence will be able to stay open until 6 p.m. to support social isolation. In addition, snooker and pool halls, indoor bowling alleys, casinos and bingo halls will close in these areas for 2 weeks from the 10th of October. Contact sports for people aged 18 and over will be suspended for the next 2 weeks, with an exception for professional sport, and indoor group exercise activities will not be allowed, although the current rules will remain in place for under 18s. Gyms can remain open for individual exercise, and outdoor live events will not be permitted in these 5 regions for the next 2 weeks. And finally, we're asking people living in these 5 health board areas to avoid public transport unless it is absolutely necessary. For example, for going to school or work, if home working is not an option. We are not imposing mandatory travel restrictions at this stage, and specifically, we are not insisting that people cancel any half-term breaks that they have planned. But in general, we are advising people living in Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley not to travel outside the health board area they live in if they don't need to. And likewise, people in other parts of Scotland should not travel to these areas if they don't need to. More detail of all that I have just set out will be available on the Scottish Government website. I now want to set out some of the reasoning behind these decisions, and particularly the focus on hospitality. I know that the vast majority of pubs, bars and restaurants have worked exceptionally hard over the past few months to ensure the safety of their staff and customers, and I'm deeply grateful to them for that, and I know how tough these, albeit temporary restrictions are for the hospitality sector. But the evidence paper published today sets out why these settings present a particular risk. The R number seems to have risen above 1 approximately 3 weeks after the hospitality sector opened up, and we know that more than 1/5 of people contacted by Test and Protect report having visited a hospitality setting. It doesn't absolutely mean that is where they got the virus, but it does show that these settings pose a particular risk of transmitting the virus. And that makes sense from what we know about how the virus is spread. Indoor environments where different households from different age groups can mix inevitably present a risk of transmission. That risk can be increased in some hospitality premises if good ventilation is difficult and if it is hard to control the movement of people. And of course, the presence of alcohol can affect people's willingness to physically distance. For all of these reasons, significantly restricting licensed premises for 16 days temporarily removes one of the key opportunities the virus has to jump from household to household. Of course, we have already restricted the other of those, which is transmission within our own homes. And this is an essential part of our efforts to get the R number back below 1. It's also worth noting that many other countries are right now introducing restrictions on hospitality, no doubt for the same reasons. Ireland, France, Germany and Belgium have announced a variety of different measures over the past few days. I mentioned earlier that one of the things we are trying to do is balance the public health harm caused by COVID with wider economic and social harms. I know that the measures we are proposing today, although they are temporary, will have a significant impact on many businesses, and I am sorry for that. But since the Government is placing an obligation on businesses, we also have an obligation to help them financially. So I can announce today that we are making available immediately an additional £40 million to support businesses that will be affected by these measures over the next 2 weeks. We will work with the affected sectors, obviously especially hospitality, in the coming days to ensure that this money provides the most help to those who most need it and that it gets to them as quickly as possible. For the rest of this month, businesses can also still use the UK Government's job retention scheme, the furlough scheme. However, that now requires a significant contribution from employers. So one of the things we will discuss with businesses in relation to our own support package is how we can mitigate some or all of that contribution. As I have indicated, our intention is that these additional measures will be in place for just over 2 weeks, incorporating 3 weekends from 6 p.m. on Friday for hospitality to Sunday, the 25th of October. Of course, we will keep the situation under review between now and then and keep Parliament updated. But we hope that the restrictions already in place and those I have announced today will stem the increase in new cases. But I can't stress enough that fundamentally is down to all of us. The more we comply with all of the restrictions and all of the advice, the more effective they will be. It's also important, because we do want these measures to be temporary, that we use the next 2 weeks to prepare, protect and prevent, to further strengthen our resilience and our ability to live alongside this virus. So I can confirm that we will also, over the next period, take the following steps. Firstly, we will introduce regulations to extend further the mandatory use of face coverings in indoor communal settings. This will include, for example, staff canteens and corridors in workplaces. We will take action to strengthen compliance with the different strands of the facts advice, focusing particularly on areas where we know from our own research that compliance is not yet high enough, for example, the need to self-isolate. I can also confirm that from this weekend and across Scotland, we are asking shops to return to 2-metre physical distancing and asking them to reintroduce the mitigations they put in place earlier in the pandemic, for example, one-way systems in supermarkets. We will also work across all other sectors to review and, where necessary, tighten the guidance and regulation on their operating practices. And in addition, over the next 2 weeks, we will be conducting a further review of our testing strategy, setting out the further steps we will take to expand capacity, which is already well underway, and build resilience, and also the further steps we will take to extend testing to more people and more groups of people in our society without symptoms. And lastly, we will finalise a strategic framework setting out the different levels of intervention which can be adopted in future, either locally or across Scotland, depending on how the virus is spreading. We very much hope to align this broad framework with those being considered by other UK nations, although of course each nation will take its own decisions on implementation. We will, subject of course to Parliament's agreement, put this strategic framework to a debate and vote in Parliament in the week after the October recess. Presiding Officer, I am well aware that the measures I have outlined today are disruptive to many businesses, obviously especially hospitality businesses, and they will be unwelcome to many people across the country. But although they are significant, as they need to be to make an impact, they do not represent a lockdown. In fact, they are designed to reduce the likelihood of a future lockdown. We're not requiring people to stay inside all day as we were earlier in the year. Schools will stay open, learning will continue in our universities and colleges, shops will continue to trade, businesses like manufacturing and construction will continue. And these new restrictions are intended to last for 16 days. They are intended to be short, sharp action to arrest a worrying increase in infection. Although they are temporary, though, they are needed. Without them, there is a very real risk, Presiding Officer, that the virus will run out of control by the end of this month. But with them, we hope to slow down its spread, and that will help us keep schools and businesses, including hospitality businesses, open over the winter. And fundamentally, it will also save lives. So I'm asking everybody across the country to please follow these new rules and continue to take the other basic steps, difficult but basic steps, that we know will protect you and each other. Please do not visit each other's homes for now. Work from home if you can. Download the Protect Scotland app if you can and haven't already done so. And of course, remember facts. Face coverings, avoid crowded places, clean hands and hard surfaces, 2-metre distancing and self-isolate and get tested if you have symptoms. Sticking to all of this isn't easy, and after 7 long months it is harder than it has ever been. But it is essential. It is the best way to look out for each other, and now more than ever we all need that spirit of love and solidarity that has served us so well. And hard though it is to believe it right now, all the hard sacrifices we are making will hasten the brighter days that do lie ahead. The pandemic will pass, so let's do all we can to help each other through it. Let's stick with it, and above all, let's stick together. And my thanks again to everybody across the country for everything you are doing.